Hello everyone, my name is Mieke and I'm a registered Division 1 nurse working in a local general medical practice where my main role is to conduct the nursing part of the over 75-year-old health assessments that we offer at our clinic. I have got some notes here because I'm not used to doing this and I do want to make sure that I give all the relevant information, so please bear with me. I've been asked as part of Carers Week to give you an idea of what happens at these over 75-year-old health assessments and how it may be relevant to carers if you are a carer. Our clinic offers the over 75-year-old health assessments, but some clinics don't. It depends on whether they have got the resources and whether they are able to do it. It's of two parts. The first part is a nursing part, so that's where I come in and I see the patient for about 40 minutes. In some places it's longer and they do a bit more assessing, but this is what I do in my practice and that's what I will talk about. And then the patient will see me for about 40 minutes and then see their GP that they usually go to for about the same amount of time, sometimes shorter, sometimes longer. So the first thing I'll talk about is that this over 75-year-old assessments are one of the federal government strategies to support people to keep them in their homes as safely as possible for as long as possible. And we know that that is one of their main objectives in dealing with people over 75. It's an annual assessment, and first one will be at 75, and then every year after that you are able to have the assessment again, and the government covers all that. It pays for all of that, whether you're a pensioner or whether you aren't, as I said, as part of their strategy. So the idea is that you will come along for your first one when you're 75. You'll get a letter or some invitation and you come along and then we will start the assessment. The first thing to say is that it's not a test. It is basically a health and well-being checkup, really, I suppose you could say, to where you are at this stage of your life. And I will just go over, I've got a health assessment here and I'll go through what's on that, and then I can talk about the advantages of it that we see and that the government sees in it, and hopefully you will too. So the first thing we do is check your details. So it'll be your address, your name, of course, your date of birth. Do you live alone or do you live with a spouse or relative or friend? Because that can be important, because we want to know, do you have someone there in case of an emergency or if anything was to happen, that you've got people that you can contact quickly? And if not, then we can look at maybe, would you maybe something like a personal alarm or something like that. So that is important, whether you live alone or with someone else. And two, whether you've got children around, grandchildren, people that can care for you. So we record that at the first visit, and then we usually check on that each year as you get older. The other part is a health screen, so for chronic illnesses, so whether you've got a past history of asthma, diabetes, cancer, anything like that. And then I can have a quick look at that, and then I can see just quickly, because we don't really have that much time when we do the assessments. If you're a diabetic, then how's your diabetes going? Are you having the relevant testing? Whether you need any further education, things like that. The same with asthma. Is your asthma controlled? And how's your medications going with that? And then we just quickly talk about that, because if it's an issue, then I will put it in the recommendations for the doctor to talk to you about those issues. And then we also talk about family history of the chronic diseases as well. Then your other past history is also there for me to see and for the doctor to see. And that's important because if you've got, so, for instance, arthritis, we want to know how is your pain controlled and how is your pain. That's important, of course, in that. Then we've got some family history. And another one that I ask usually at the end, but it turns up in the copy that you get. Every patient does get a copy of this assessment each year, so that's good, so you can keep an eye on how you're going. So another thing that we talk about is falls. We ask you if you've had a fall in the last 3 months. And if you have, then we talk about what sort of fall it was. And if you've had a few, then we need to write that down or let the doctor know to see why you are falling. Because, of course, we know we don't want you to fall because you may break a bone, and we don't want that to happen because that can impact very heavily on your quality of life, as you know. So that falls is very important. Your mobility is important, and where you're at when you come and see us. Whether you attended what specialists you attend regularly or not regularly. Sometimes people have been to hospital in the year, and we talk about why they were there and how they're going now. We do look at things like smoking, alcohol, nutrition, which is very important, exercise, whether you're sleeping well or not, just very quickly, how your brain is functioning, whether you've got a history of depression, continence, how that's going. So we just generally talk about those, because if they've changed, we need to look at those and see what we can do to help. Then I do a very, very basic eye test, just get you to read a chart. I do your blood pressure, weight, height, those sort of things. And then the doctor later on does a more physical examination looking at lungs and abdomen and skin and all that sort of thing, and anything else that we have brought up in the recommendations. We check whether your immunisations are up to date, and then we do talk about activities of daily living. So these are the things that we do each day. Anything from the eating, because, you know, it seems a very simple thing, but if you perhaps have, for example, dentures that don't fit, you're not going to be eating properly, which means you may not be getting enough nutrition and all the things that you need. You might not be eating enough. So if you've lost a lot of weight in the year that between visits, then we can talk about why and maybe halt it and see if there's anything that we can do or offer, or any service out there that can help with that. So that's that one. Anything from how do you need help with your finances, your shopping, transport? If you were quite able before to walk everywhere, and then you may have a fall or you may have been to hospital, then there are things that you could be looked at, like half price taxis, or family, or there's services out there that can help with that. Current medications, the doctor as part of this assessment will go have a look at your medications and see if there's anything there that he needs to discuss with you or change, especially after doing the examination. And then we just do recommendations. So in summary, so I will just record with the person knowing exactly what I'm writing, where what's important, and if things have changed, I'll do things like has good support at home, or walking with a walking stick, or walking with a frame now. Driving locally as compared to, maybe you're not driving at all now, or not driving at night is another common thing. So the doctor will act on these as if he thinks he needs to and as appropriate. So that's the way that I do our basic health assessment where I work. I think other places have different templates. So that's basically the assessment. The advantages, I think, too, are the first visit. So it's seen as more of a preventative thing. When you go to the doctor, usually you go for specific things. This assessment gives you a chance to talk to the nurse and to talk about general things in your health and well-being, and if there's anything that usually we don't cover. And a lot of people say to me, oh, well, I'm at the doctor's all the time, which is sometimes true as we get older, but it's not for the same assessment. This one is a more general overall assessment that we can pick things up that you might forget to tell the doctor when you go. Also, we talk about supports. So if things are not as good as they used to be, or things, for instance, your mobility is going down, or you may need more help, you may not be able to vacuum anymore, or you may not be able to do the garden, then I can give you some supports that are available. For instance, My Age Care. Not everyone knows about My Age Care, and that you can get support from My Age Care they do the home care packages, and I do have information on that, and there is lots of things that they can help you with. It's always tailored to you. Once you get the funding, it can take a while for it to come in, but I always encourage everyone to at least register with My Aged Care when they are over 65, and hopefully you may not need it, but if you do, then you can just ring them up, and they will usually either send someone out or talk on the phone, and if circumstances change, then your package can change. I also, if for instance, also the basic testing, some places always do all the testing, but we just do basic testing, which is all you really can do in this assessment, and that's, for instance, like a memory test if you feel you need one, or and the eye test. If the doctor then thinks, and after discussing with you, that you may need further investigations, then they will either refer you, they may want to do a care plan with you, but that would be another visit. So it's just to get these things started, just very basic, and this is why this assessment is so good, because it picks them up. So yeah, as I said, every place is different. The medications. So that's basically all I wanted to cover with that. In regard to carers, I think that it's very important that carers take time out, for themselves too, and to check on their health and well-being. One of the questions actually on the assessment is, are you a carer? And if you are a carer, then we will sometimes discuss, well, how's it going? You know, are there things that we can help you with? Are there things that are worrying you? And as a carer, if you do, please, when you get your invite, make the time to do this for yourself as well as for the person that you're caring for. Because if we can prevent things that may happen further down the track, or of course, most important, give you the support that you need. I hope this has been of some interest for you, and thank you for listening, and goodbye now.